Having an unwell child is never easy, but if they're vomiting or have diarrhea, it takes it to a whole new level. Hi, everyone. Thank you for joining us on Mother Doctor Nurse for another episode today when we answer your questions on child health and safety. Thank you for joining myself, Dr. Deb Levy, holistic pediatrician and mum of two girls, and the wonderful Sarah. Would you like to introduce yourself, Sarah?
Sure. My name is Sarah. I am a paediatric nurse, founder of CPR Kids, and I'm also a mum of two girls. And we're coming to you today from Gadigal and Bidjigal land. I'm really looking forward to talking about gastro today. It seems like it is a really pertinent topic with so much of it going around at the moment. I say that, but it's always really going around, isn't it, Deb? When do we tend to see a gastro spike? Is there a certain time?
Well, I mean, Sarah and I were just chatting about this before we started, but sorry, you have to excuse me for 1 second. My daughter has just walked into the room.
It's school holidays. This is how it is. It is school holidays. All good, Deb. So, yes, yeah, you can tell that I'm sure you are having exactly the same problems at home at the moment if you're trying to work and have the kids at home at the same time. Luckily, my two are occupied at the moment. So my oldest, hopefully she's cooking something because then I will benefit from that as well, let's be honest. Having a teenager who likes to cook is definitely a good thing. And my youngest is hopefully... you know what, I'm not entirely sure what she's doing. So at least she's of an age where I don't need to worry about that too much. But the reason we're coming to you with gastro today is because there has been so much that we've been asked quite often over the past 2 weeks if we can do a live about this very subject, because it seems like that every child in daycare at the moment is spewing and pooing. So Deb, as we were saying, everything good? Everything all right?
Yes, my 5 and 7-year-old are arguing about what's on TV because I thought that would be a wonderful time for them to watch TV and give me a bit of a break so I can do this, but clearly I got it wrong. So I apologize for that.
Please let us know what you're doing in the school holidays. How are you dealing with being able to juggle everything? Let us know in the comments, please. Give us some hints and tips.
Yeah, and the rain is making it so much harder.
Yeah.
But I can't complain considering what some families are going through currently with the rains and floods here.
Yeah.
So I don't feel like I can really say anything about that. So let's dive in to the squishy, awful topic of gastro.
Yes.
So should I just start, Sarah?
Yeah, I think so. I mean,
as I've already.
You go. Go.
Sorry, I think we've probably got a bit of a lag. So I guess what is gastroenteritis is probably the question that Sarah was going to ask me. And essentially, it's an illness associated with vomiting and diarrhea. So that's the classic presentation of it. And usually this is a viral infection, which means it's associated with a fever as well. And typically we see a pattern of a child's a bit unwell, maybe just a little bit off sorts, with a bit of a fever. Then the vomiting starts, and that can go on for a little bit of time. And then the diarrhea kicks off. And as the diarrhea kicks off, what we will often see is that the frequency of vomiting actually decreases. So that's often the pattern that we see. And then the duration of the illness in itself is very variable. But as for any typical viral infection, it can be around about, that 5 to 10 day mark.
Yep. Which seems like an extraordinarily long time, doesn't it? Like, that 5 to 10 days, like that feels like an eternity. So we've talked about, about the gastro. What signs and symptoms would we expect to see in our child? So how will it start? Do they just immediately start vomiting, or might they have a fever? How might it start? How can that indicate to us that it might be the dreaded gastro that's come to the house?
Well, often a fever does, precede the vomiting, but not always. And the other thing you may see is that your child may be off either their bottles, their breast milk, or their solids. So a general loss of appetite. That's often how it starts off, and then it can quickly deteriorate. And as you and I know, Sarah, as mums, it's often in the middle of the night when we suddenly wake up to a bed full of vomit.
Yep. that's it. And often then, I don't know about you, but certainly my children weren't very good at aiming. So it's making sure, and this is a really good mum tip, please, and dad tip, make sure that you have a really good receptacle that you designate for vomit catching use. Certainly in the car, I love to use those vomit bags. They're really, really handy. You can get them from the chemist. They're great at home too, when you've got that child who can actually bring it to the mouth. Otherwise, a wide vessel, preferably a bucket, something like that, that has got a large surface area to aim into is very, very handy. And certainly, kids often don't know when they're about to vomit. They say that their tummy's sore, that they might be doubled over in pain. They might not associate that pain actually means that they are about to vomit. So it's often sprung on you very quickly. So in saying that, we've talked about so far, what to expect and what it looks like, what can cause gastro. But when our kid does have diarrhea and vomiting, what are the concerning red flags that indicate that we do need to seek medical help rather than just a simple gastro that we may be able to treat at home?
Yeah. So first and foremost, it'll be the age of your child. So younger children, certainly under 6 months of age, we're always more cautious with. And this is because their reserves are less. So young babies can get very sick very quickly and dehydrated as well. So, definitely that under 6 month mark. And then obviously any other child with underlying significant medical conditions would be in that high risk group. The next thing to look at would be the general state of your child. So if you have a child who is otherwise pretty well, still playing with their toys, still chatting to you, but is having the occasional vomit, that's a lot less concerning than a child who is what we would call flat, lethargic, lying down, really not wanting to do anything. And then the other big category of really not wanting to drink anything, which brings us to the point of, can your child be dehydrated? And that will be another indicator to seek more urgent medical attention. And what are those signs of dehydration? First and foremost, it would be, it's what you see. So if they're not drinking a lot, that's obviously a big red flag to me. And then also if they're not weeing a lot, and this is age dependent, and are they having less wet nappies? Are the nappies lighter? Or are they just going to the toilet less frequently? So that's what to watch for. And then obviously depending on the age, it will determine what frequency is normal or abnormal. The other point in terms of dehydration is thirst. And I'm kind of hesitating before I say that, because thirst, obviously, this is only in a child who's able to actually express their need for something to drink. So in verbal children. And then second is actually quite a late sign. They can be starting to get dehydrated before they actually express that they're thirsty. The other things that you might see would be, maybe their mouth is dry, inside their mouth is dry. That's more specific. If they cry, they have less tears than they would normally. But again, that's quite a late sign. And, usually, I find the less weeing is the much more sensitive indicator. You'll notice one thing I haven't mentioned, and I'm just going to talk about it now because I have a lot of families that come to me and say, well, what about this? What about this? And I just want to say it's not a sign that either I recommend looking for or that I believe is very reliable, and that is the sunken fontanelle. The fontanelle is that squishy kind of diamond shaped area on the top of the baby's head. It's usually there within the first year, just under, it closes up. But it used to be that it was, if you notice the fontanelle is sunken, that it's lower than normal, you need to suspect that your child is dehydrated. But I guess there's just a couple of things I want to say about that. One, I don't think it's accurate, because if you lie your child down, sit them up, if they're crying, if they're talking, if they're playing, it fluctuates. And two, I don't believe that that's a sign that anyone should be looking at, because it's so non-sensitive. And three, if your child is really sunken, then they're significantly dehydrated, and we've kind of missed the boat in terms of picking it up early. Anything you want to add to that, Sarah?
Oh, no, I think that you've summarised that beautifully, that we need to be really watching for those other signs that are much more apparent there. And also, I think as well, when you're watching your child and you're just seeing them, there's so much more is coming out than what's going into them, that's got to be that red flag that you're just going, no, this is not right. I cannot replace the fluids that are coming out of my child. And, I've had times where I've looked at my kids and gone, wow, that is a lot coming out of you. That, we're not being able to replace this adequately. We need to go to the doctors for sure. So I think that's an important thing. So
yeah, absolutely. Because just to elaborate,
No,
Sarah, on what you're saying, I think that it's very unlikely a child is going to be dehydrated if they're having like 2 or 3 vomits a day and are otherwise drinking normally. But if they are having those profuse vomits, or perhaps after every time they drink something, then they vomit, that definitely would make me think that they are going to become dehydrated. And the other point I want to make, again, in an otherwise developmentally normal child, who's able to express themselves, they're very unlikely to become dehydrated from diarrhea alone.
Okay.
And again, there's the caveat that, yes, if they have profuse watery diarrhea and they're unable to drink or unable to verbalize that they're thirsty, they are at risk. But, typically speaking, a child who only has diarrhea is usually still able to drink and will usually maintain their own hydration.
Okay. All right. But of course, that if you are concerned about that, we don't want you to be umming and ahhing over it. We want you to seek medical help. It's really, really important, whether it's calling Health Direct, whether it's making an appointment with your GP, then it's really, really important that if you are in doubt, don't just wait, get that advice. Really, really, really important, please. So say our child is just having those few vomits. We're happy that, we're going to try and get on top of it at home. We're happy it's gastro, it's going through the family. 1, what do we need to do at home? And 2, how can we prevent ourselves from getting it too? And is that even possible?
Okay. So I think I'll address your second question first and say hand washing. That's the big one. Hand washing, and then no sharing of food utensils, toys, etc. for siblings. So that would be the biggest. Yes, you can also get it from oral spread, and obviously fecal oral spread as well. So I wouldn't be doing lots of mouth slobbery kisses or anything like that during gastro. No. But definitely hand washing would probably be the number one recommendation I have.
Yep.
And that's after every single diaper change, everything really, because you don't want to get gastro too.
No.
And then to address your first question about what should you do at home, obviously it's a little bit dependent on the age of your child, but overall it's about ensuring they maintain their hydration. So it's very typical for children who are unwell for any reason to go off their food for a little bit. And that's fine, because often what we'll see is their weight may drop a little bit over a few days, but then when they get better, that week or 2 later, it'll be right back up to normal. So we don't particularly worry about them going off their food for a few days. But obviously, and I keep on saying this, so I hope it's not boring for people, but it's all about maintaining hydration and ensuring they're getting their liquids properly. So for the under 1, that's having whatever milk that they're on. And by milk, I mean breast milk or formula. And then over the age of 1, water, whatever they're drinking. So, let me just break it down a little bit further. So if your child is vomiting, what we want to offer them is smaller, more frequent liquid options. I wanted to say feeds, but that, is indicating younger children. So we want to, give them that opportunity to have some fluid, but minimize the risk of them vomiting that up, so whether that's 15 mils every 15 minutes, or a short breastfeed, and then offer them again an hour later or half an hour later, or however old your child is, and certainly you can get some guidance from your own healthcare provider on this. But really that's what we're doing. We're offering them small amounts more frequently in the hope that they maintain their hydration and are less likely to vomit. The other option is around how to get them to have liquids. So often you'll find a child who's nauseous may not want to have liquids, may not want to drink, and then you may need to resort to other options. And I find icy poles are fantastic, and because kids usually enjoy it, and it's a wonderful way to get liquid in. The other thing I want to talk about is your hydration fluids, your oral rehydration fluids. Sorry, I should have probably said. those are those formulas you get usually from pharmacies. I think you can get in some supermarkets as well. I'm saying it.
Yep,
Yes, Sarah's nodding her head at supermarkets too. Those are those brightly colored ones, the electrolyte solutions made specifically for people who are vomiting, and that's usually for all ages. Again, that under 1, you really should be getting specific guidance around that under 1 year. The option around that is either as a liquid, and they can have it in a little cup, they can have it in a syringe if it's fun for them, or as an icy pill. You can often use all those 3 options. When do I recommend switching from like a regular kind of fluid to a rehydration fluid? To me, that depends on how much the child is vomiting. Again, if you're only having like a handful of vomits over the course of the day and your child is otherwise not looking too unwell, they can probably just use regular fluids, or maybe even some diluted fruit juice, 1 part to 4 parts of water. But anything more than that, and certainly, if they're looking, that bit flatter, they're not so energetic, then I would be switching to rehydration fluids, or, if it's extended beyond that 24, 48-hour period. Again, and these are general kind of indicators that I'm giving, but it very much depends on the age of your child as well as the state of your child.
Yep. And I think the important thing to say here as well is that often parents can understandably get confused between sports drinks and the oral rehydration fluids. Sports drinks are not suitable for children. So not mentioning any brands, but the sports drinks that you see advertised that are in the supermarkets and so on, they're not suitable for kids. Oral rehydration solution is different. So make sure that you are speaking to your pharmacist about what is appropriate for your child as well. Okay, really important.
Great point, Sarah.
So, yep, there's just a little bit of a lag between us. If you're wondering why sometimes we're
just I've gathered
pausing, it's there is a lag. So sorry about that. In this weather, the interwebs are not working as they should. So don't mind us. So Deb, is there anything else that you would like to tell us? What I've certainly gotten from this is that the keeping hydrated is the #1 key. And if you are in doubt, please go and seek that medical help. Is there anything else that you want to have a chat about before we finish up today, Deb?
Look, we haven't really touched on diarrhea today, and I think that probably deserves a whole chat on its own, because the causes of diarrhea extend way beyond gastro, and those of you who know me know that I can talk endlessly about poop. So perhaps that's something we should do next week, is talk about diarrhea, or we'll certainly schedule it for the next few weeks. As I know we'd thought about doing something else next week, but. But obviously, as I said, diarrhea accompanies it. And the other one thing I do want to mention, just on that same topic, is we always, as healthcare practitioners, always are nervous if a child is only vomiting, to call it gastro. Sorry, I should rather say that. Can you hear my children fighting in the background?
Yeah.
Can you hear them? Just hold on 1 second. Bless them. I don't know if that's
Yeah. So as Deb was saying, it is concerning of that child who is just vomiting. So when a child is vomiting, they've got the diarrhea, they may have tummy cramps that are relieved after a vomit or a diarrhea. There are other people in the house or at daycare at school who have got gastro. That all points towards the gastro, but particularly when a child does have vomiting alone, there are lots and lots and lots of other causes that can be quite concerning. And so that's why it's really important that if your child is just vomiting alone, that you do seek medical help. Deb, what did you want to add to that?
No, that's exactly what I wanted to say. Vomiting alone without developing diarrhea, we have to look further into the many causes, again, age dependent. But UTI always jumps up as one of the options for me. So certainly make sure that you discuss that with your healthcare provider. And I apologize again for my children being a bit crazy today.
Oh, there's no need to apologize, Deb. It is real. It is life for many of us at the moment. So it's all good. It's all good. I'm actually very surprised that I haven't had one wandering shot here and just come and walk past with a little bit of a But anyway, that's okay. All right. So we will come to you at the same time next week, provided, that the school holidays haven't thrown something else at us that we shouldn't, because there may well be some illness as well, but hopefully not. We'll see. We're looking forward to seeing you then. And please remember, always tell us if there is something that you would like us to talk about. So make sure you DM us, either myself at CPR Kids and Casey, who is the digital manager here. So she loves to hear from you. And of course, over to Deb on her Instagram page at Dr Deb Levy. Make sure you have a look around there while you're there. She's got some great, helpful stuff. So please do that. Apart from that, we'll see you next week. Thank you, everyone.
Thanks, everyone. Thank you.